Hi everyone, we already introduced tutorial 1 and therefore welcome to the second tutorial in hematology. We are still discussing anemias, and this time around we'll focus on the scenario-based questions so that we get more understanding than just direct answers. Okay, scenario-based questions are one of the major questions that you need to utilize in order to prove that you know the concept, you understand the concept. And before I forget, this is Clement Chilambe from Clement Chilambe Tutorials, and without further ado, we can start discussing these clinical scenario-based questions. All right. So we start with question number 1. A 45-year-old man presents with fatigue, pale skin, and shortness of breath. Blood tests reveal a low hemoglobin level. The most likely cause of this anemia is what? A. Iron deficiency. B. Vitamin B12 deficiency. C. Folic acid deficiency. And D. Aplastic anemia. So when discussing or when looking at a clinical scenario question in hematology, look at first of all who they are talking about. Who are they talking about in this case? A 45-year-old man, right? A 45-year-old man. Then what signs and symptoms is this man showing? Fatigue, pale skin, and also shortness of breath. Okay, those are symptoms then. What is the lab saying? Low hemoglobin level. Then we can now come to a conclusion. Which type of anemia has got these presentations? Okay, so first of all, we know that in an adult man, first of all, an adult man, and someone who's not mentioned here is a postmenopausal woman. Okay, so postmenopausal women and an adult man, the most common cause of anemia is what? Iron deficiency anemia in these two. So from the kind of a person or a patient that we've been given here, we already know that it's iron deficiency anemia. So if you can't get it from here, then you also need to realize that why in adult men and postmenopausal women. This is because there's what is known as the occult gastrointestinal blood loss, right? So this is very common, and this is what causes the anemia. And then vitamin B12 deficiency, folic acid deficiency, and later also discuss aplastic anemia. These two, B and C, have not really pointed to the question itself has not really pointed to nutrition deficiencies. No, that is vitamin B12 or folate, or it has not pointed to bone marrow failure, which is aplastic anemia. No, therefore, question answer A is the best answer in this case. This is how you analyze a clinical scenario question. If you can't get it from a 45-year-old man, you need to know that pale skin, shortness of breath, and fatigue, all these are the causes of what? All these are signs and symptoms, of iron deficiency anemia. And low hemoglobin level is itself a definition of anemia. And you know the hemoglobin. What when you have low hemoglobin? We'll discuss this later, and you can actually confirm to the lectures. But for now, this is actually good evidence that it's iron deficiency anemia. Right. Question number 2. A 60-year-old woman with a history of pernicious anemia reports numbness and tingling in her hands and feet. The most appropriate next step in her management is, so what are they asking here? The management. Management of who? A 60-year-old woman. And then, what's wrong with this 60-year-old woman? They have a history of pernicious anemia. Okay, they have a history of pernicious anemia. And is there anything that is important to recognize or to know about? The numbness and tingling in her hands and feet. These are all clues. Look at how many clues are here. Look at this. So the numbness itself, let's start from here. The numbness and the tingling in the hands and feet of this 60-year-old woman are signs of a neurological involvement from the ongoing vitamin B12 deficiency. And the diagnosis of pernicious anemia is already known, right? It's already known. So the next step is to do what? To ensure adequate treatment, which may involve what? You already know, I think, the answer. This may involve increasing the dose or frequency of vitamin B12 supplementation. Yes, so the best choice in question number 2 is A. Right, this is very straightforward. Now, it's also important to go through these other options, refer her to for a Schilling test, initiate folic acid supplementation, perform a bone marrow biopsy. You can actually be tempted, especially when you say history of pernicious anemia. Schilling test, remember what we discussed in tutorial 1? So you might be confused, say, oh, they are saying pernicious anemia, therefore it's directly Schilling test, right? But wait, they're talking about this woman, the signs and symptoms, and also the next step in her management, because we already know that it's pernicious anemia. Why do you want to do a Schilling test? Let's go to question number 3. A 25-year-old pregnant woman presents with severe fatigue, pale skin, and a sore tongue. Laboratory tests reveal macrocytic anemia. The most likely cause of her anemia is what? A. Iron deficiency. B. Vitamin B12 deficiency. C. Folic acid deficiency. D. Thalassemia. Look at this question. Who are we talking about? A 25-year-old woman who is pregnant, not just an ordinary woman. And what is wrong? And how do we know that there's something wrong with them? There's severe fatigue, there's pale skin, and there's also a sore tongue, right? What is the lab saying? Macrocytic anemia. Macrocytic anemia. So the most likely cause of anemia is what? First of all, there are many clues here. So I've already read the choices that we have. So there are a lot of clues here. 1, pregnant woman. Okay, pregnant woman. This woman is pregnant here. Then sore tongue, and macrocytic anemia. All right, so folic acid requirements actually increases significantly during pregnancy, and I hope you know this. So macrocytic anemia is in a pregnant woman is actually a highly suggestive of what? Folate deficiency, right? Folate deficiency. So folic acid deficiency. You might be tempted to say, oh, vitamin B12 deficiency, but look at the patient that we're dealing with. Pregnant woman, 25-year-old, and they have macrocytic anemia. So pregnant woman is one of the key word here. And when you talk of the a sore tongue can occur in both vitamin B12 and also folate deficiency. So be careful. That's why I said one of the keywords that you also need to notice, sore tongue, because you might be fighting the answers here. And but folate, right? Folate is more common in this context. Folate is more common in this context. In as far as in folate deficiency and also vitamin B12 deficiency, we can have these macrocytic anemia. Yeah. Question number 4. A 10-year-old child with a known history of sickle cell disease is brought to the emergency department with severe abdominal pain and fever. The most appropriate initial management is, so, okay, 10-year-old child. What do they have? Sickle cell disease. They have what? Sickle cell disease. Okay, they have, of course, severe abdominal pain and fever. Oh, that is also a critical keyword that we need to understand. Severe abdominal pain and fever. And initial management. This word here, initial. The most appropriate initial management is what? A, oral pain medication and observation. B, intravenous fluids and antibiotics. C, blood transfusion. D, referral to a hematologist. Which one do you choose here? So this presentation suggests what we actually discussed, remember, in tutorial 1, a vaso-occlusive pain crisis, which is actually complicated by severe not a severe, but this shows a potential infection. Yes, this shows a potential infection, and a fever in a sickle cell patient is an emergency. That's what it's saying. Is brought to the emergency department because of fever. It's an emergency. Initial management, therefore, must be what? Intravenous fluids for hydration and the broad spectrum antibiotics. Why broad spectrum antibiotics? Because we want to cover for potential sepsis, especially from, I like this term, encapsulated organisms. Right, so we choose B to be the correct answer on question number 4. Question number 5. A 35-year-old man with a history of alcohol abuse presents with easy bruising, frequent nosebleeds, and pale skin. The most likely cause of this anemia is what? A. Iron deficiency, B. Vitamin B12 deficiency, C. Folic acid deficiency, D. Aplastic anemia. So, question number 5, what do we think is actually the correct answer? So, we're dealing with a 35-year-old man, alcohol abuse, okay, 35-year-old man, alcohol abuse, easy bruising, nosebleeds, and also pale skin. The most likely cause of his anemia is what? All right, so all these symptoms indicate a pancytopenia, right? There's anemia, which is pale skin here. There is thrombocytopenia, which is easy bruising here. So these are signs and symptoms of what I'm talking about. And then we have nosebleeds also is an example of thrombocytopenia. And then the key word, that's why I've underlined it here. Alcohol abuse. Alcohol abuse, chronic alcohol abuse is actually a non-toxin that can suppress the bone marrow function, leading to aplastic anemia. They have given us what here? Folate. Okay? They have given us folate. They've given us folate. Of course, folate is also associated with alcohol abuse, right? It actually doesn't typically cause bleeding tendencies. That's what we're saying. Folate deficiency, no, even if it's common for alcohol abusers, but in this case, folate deficiency doesn't typically cause bleeding tendencies. Yeah. So we pick aplastic anemia to be the correct answer. A 6-month-old infant with a family history of sickle cell disease is found to have sickle-shaped red blood cells on a blood smear. The most appropriate next step in management is what? So a 6-month-old infant. Of course, what's the condition? Sickle cell disease. Presentations, what's the lab saying? Sickle-shaped red blood cells. This reminds me of 0.2% sodium metabisulfite. The most appropriate next step in management is what? So we have all the clues here. A, initiate hydroxyurea therapy. I have to underline this word. Next step, after confirming that it's sickle-shaped red blood cell, what do we do? So A, initiate hydroxyurea therapy. B, recommend blood transfusions. C, prescribe prophylactic penicillin. D, refer the patient for a bone marrow transplant. Actually, the correct answer here is before we shout out the correct answer, let's analyze it, isn't it? So that you might also have the chance to think about the answer. So the diagnosis of sickle cell disease here in this scenario is confirmed, isn't it? Yes, it's confirmed. And the standard of care rather for infants with sickle cell disease is to initiate the prophylactic penicillin by 2 months of age. Why is that done? To prevent life-threatening pneumococcal infections, right? So in this case, this is actually the most critical next step, and therefore we get C to be the correct answer. Prescribe prophylactic penicillin to prevent life-threatening pneumococcal infections, as I've said. That's the correct answer on question number 6. 7. A 25-year-old woman with a history of heavy menstrual bleeding presents with fatigue, dizziness, and pale skin. Laboratory tests reveal a low ferritin level. The most appropriate treatment is what? So this is a 25-year-old woman with a history of heavy menstrual bleeding, presenting with fatigue, dizziness, and pale skin. The laboratory tests reveal a low ferritin level, and therefore the most appropriate treatment is what? A. Oral iron supplementation. B. Intravenous iron infusion. C. Blood transfusion. D. Hormonal therapy. Look at this. We are dealing with a 25-year-old woman. These three: heavy menstrual bleeding and signs, pale skin, dizziness, and fatigue. Laboratory tests a low ferritin level. So one of the best clues with scenario-based questions is you can be given very, very big questions with values. No, the mean corpuscular volume was this. No, that is the MCV. The complete blood count was this. The hemoglobin was this. There are certain clues that you need to get. Only among the clues, there can only be one clue which can tell you everything. Okay, so you have to be very, very careful. They are not really complicated. Actually, they give answers because they substitute a lot of things. They make you remember. In fact, they make you study first. Then you answer the question. It's like giving you an answer already. So we have 4 options here: oral iron supplementation, intravenous iron infusion, blood transfusion, and hormonal therapy. Which one do you think is the answer? Okay, so look at this. All this you're seeing here is a classic case of iron deficiency anemia, which is secondary to what? Chronic blood loss. Why? Heavy menstrual bleeding. We've already heard that. The first line treatment, therefore, okay, the first line treatment is oral iron supplementation. Why are we giving oral iron supplementation? We want to replenish what? We want to replenish stores, right? Intravenous iron is reserved actually for cases where oral iron is not tolerated or where oral iron is ineffective. So we get A as the correct answer on question number 7. A 60-year-old man with a history of gastric bypass surgery reports increasing fatigue and shortness of breath. Laboratory tests reveal a low vitamin B12 level. The most appropriate management is, so we are talking about a 60-year-old man with a history of gastric bypass surgery who reports increasing fatigue and shortness of breath. The lab is saying low vitamin B12, shortness of breath, shan. And we're dealing with a 60-year-old man. Then let's also consider this: gastric bypass surgery. All right, these are the clues that I can go for. And I don't like actually forget appropriate. Okay, these might be ways in which this can be done, right? But we want the appropriate management among the 4. Which one is it? So I like taking this as also very, very key statement in answering clinical scenario questions, because the last part can actually tell us also something. So gastric bypass surgery, first of all, this one here, gastric bypass surgery leads to loss of intrinsic factor producing cells and also impaired B12 absorption, right? Gastric bypass surgery, very, very big clue here. So since absorption is compromised in this case, so oral supplementation is ineffective. We can't do oral supplementation. Have you seen? Lifelong intramuscular or high dose subcutaneous B12 injections are the ones that are required, and therefore B is the correct answer. We can't refer for endoscopy. We can't initiate a folic acid therapy. Not really. We only go for intramuscular vitamin B12 injections because of the reasons that I've given. 9. A 35-year-old woman with sickle cell disease presents with acute chest pain, fever, and shortness of breath. The most likely cause of her symptoms is what? A. Sickle cell crisis. B, acute syndrome. Okay, we're talking about a 35-year-old woman, and there are symptoms of acute chest pain, there is fever, and there is also shortness of breath. We're talking about what? The mechanism of why these symptoms appeared: shortness of breath and acute chest pain in a 35-year-old woman. Okay, so acute chest syndrome itself, this one here, is a common and a very severe complications of sickle cell disease that we must know. And it is actually characterized by chest pain, fever, and also pulmonary infiltrates, shortness of breath. Remember, pulmonary infiltrates. And how does this come about? It can be due to what? Infections, yes, infection, or it can be due to infarction from sickle cells, right? Because I'm just thinking about the mechanisms of sickle cell disease. And pneumonia can be the cause, actually. While pneumonia can be the cause in this case, acute chest syndrome here on B is the specific diagnosis that encompasses this presentation that we've talked about in a sickle cell patient. So we go for acute chest syndrome. A 2-year-old child with sickle cell disease is brought to the emergency department with a 3-day history of fever and letargy. The most appropriate initial management is, so a 2-year-old child with sickle cell disease brought to the emergency. Do they have fever? Yes, I already said last time that fever in a sickle cell disease patient, especially child, is an emergency. And 3-day history, this is bad. Then 2-year-old is a 2-year-old. I'm just marking the clues here, 2-year-old. And then appropriate initial management: A, oral antibiotics and observation; B, intravenous antibiotics and hydration; C, blood transfusion; and D, referral to a hematologist. Okay, which one could be the answer here? So actually, this is I think we discussed something that has to do with this. It seems like a repetition. Okay, this question maybe 4, I think, somewhere there. So fever in a young child with sickle cell disease is a medical emergency, as we said, which requires immediate hospitalization for intravenous antibiotics and also supportive care with hydration. And therefore, we choose still B to be the correct answer. We go to question number 11. So question number 11. A 55-year-old man with a history of chronic kidney disease presents with fatigue, pale skin, and decreased exercise tolerance. What is the most likely cause of his anemia? Okay, so as I said earlier, we look at who we're dealing with. 55-year-old man, and then 55-year-old man has a history of chronic kidney disease. Then what is the presentation? Decreased exercise tolerance, pale skin, and also fatigue. So what do we say? Is it iron deficiency? Is it vitamin B12 deficiency? Is it folic acid deficiency? Is it anemia of chronic disease? So with this 55-year-old man, we know, look at this chronic kidney disease here. We need to recognize that the classic cause of anemia, one of the classic causes of anemia, is chronic kidney disease in this case. And let me just say, chronic kidney disease is a classic cause of anemia of chronic disease. Yeah, that is put well. Why is this so? Because in chronic kidney disease, there is impairment production of erythropoietin by the kidneys. So we are saying that anemia of chronic disease is the correct answer in this case. Question number 11. You don't have to think too much. The answer was just there. All right. 12. A 30-year-old woman with a history of heavy menstrual bleeding is found to have a low hemoglobin level. The most appropriate initial management is what? I think we even discussed this, question number 12 also. And we said oral iron supplementation, okay, to replenish the stores, because in this case, this is the first line management, which is actually oral iron supplementation. So 12, we have A there, okay. A 4-year-old child with a known history of thalassemia major presents with severe anemia, splenomegaly, and growth retardation. The most appropriate management is what? So we're talking about a 4-year-old child with a known history of thalassemia major. They have severe anemia, splenomegaly, and growth retardation. Look at all these symptoms, right? And signs. A, blood transfusion chelation therapy. We want management. Remember, management. Blood transfusions and chelation therapy. B, bone marrow transplantation. C, hydroxyurea therapy. And D, supportive care only. Which one is the best answer? Okay, so the mainstay of treatment for thalassemia major is regular blood transfusions. Why regular blood transfusions? To correct anemia and also suppress the ineffective erythropoiesis. This inevitably causes of course, these are complications, right? There's what is known as iron overload, which must be managed with chelation therapy. Yeah, I think when I talk of chelation therapy, you're thinking intravenous deferoxamine, which is actually correct. So we go with A as the correct answer here. Bone marrow transplantation, hydroxyurea therapy, supportive care only, no. In this case, we go for this because of the reasons that have been given. Question number 14. A 25-year-old man with a history of alcohol abuse presents with easy bruising, frequent infections, and pale skin. The most likely cause of his anemia is what? Question number 14. This is actually identical. I think we discussed something like this, and I hope you're able to answer very fast. We said that cytopenia symptoms include anemia, bleeding, and also infection in the context of marrow toxin like alcohol. Point to this alcohol here points to what? Aplastic anemia. We did talk about this, so we say aplastic anemia again. Question number 14, this one here, right? If a 35-year-old woman with a history of ulcerative colitis presents with fatigue, dizziness, and pale skin. Keyword, ulcerative colitis, okay? Laboratory saying low hemoglobin level and a high reticulocyte count. Mechanisms coming in here. The most likely cause of anemia is what? A, iron deficiency, B, vitamin B12 deficiency, C, folic acid deficiency, and D, hemolytic anemia. What do we say? In this case, look at the patient. Look at the patient, a 35-year-old woman. Look at the history here, ulcerative colitis, and also look at the lab tests. They can give values of the lab tests, but what we are interested in this case, even if they can put all the complete blood count tests and everything, we are only interested in hemoglobin. Is the hemoglobin high or low? It is low. The others don't matter. So reticulocyte count also. Is it high or low? It is high. You see? So there are small things. Values can be added just to confuse you, or for you to think that maybe the question is hard, but not really. Yeah. So what do you think is the best answer here? So we're dealing with a 35-year-old, right, woman. So here I'll start with high reticulocyte count, because other things I might just end up confusing you. So a high reticulocyte count indicates what? Indicates that the bone marrow is actively producing new red blood cells in response to what? In response to their loss. And this, ladies and gentlemen, is a characteristic feature of hemolytic anemia. Okay? Autoimmune diseases like ulcerative colitis that have been discussed here, that's why I marked it even, can be associated with autoimmune hemolytic anemia. So in general, we are saying that this is a presentation of hemolytic anemia. Okay, and ulcerative colitis is giving you because there is autoimmune hemolytic anemia, which has been discussed in the lectures. All right. Okay, so look at question number 16. This is our B here. Then this is our C, this is our A, this is our D. All right. So a 60-year-old man with a history of gastric bypass surgery reports increasing fatigue and shortness of breath. Laboratory tests reveal a low vitamin B12 level and the most appropriate management. We're talking about management here. I think we did discuss this also. Yeah, it was identical to some questions. Yeah, to a question, certain question. So we said that intravascular vitamin B supplementation injections are the best in this case. Yes, that's what we said. This is number 16. It's more like a repetition here. We said malabsorption after gastric bypass requires parenteral B12 placements. All right, or replacement rather. Okay, question number 17. A 25-year-old woman with history of heavy menstrual bleeding presents with fatigue. We did discuss this already, and we said that oral iron supplementation, which is the first line, is actually given. So I hope you're able to answer this question so fast and be able to follow through. Then we have question number 18. A 35-year-old man with a history of alcohol abuse presents with easy bruising. We also said that this has to do with what? Question number 18 has to do with, look at this now, look at this, initial management. We want the initial management here. This is actually different, so pay particular attention. A 35-year-old man with a history of alcohol abuse presents with easy bruising, frequent infections, and also pale skin. The most appropriate initial management is what? A, oral iron supplementation. B, intramuscular vitamin B12 injections. C, referral for bone marrow biopsy. D, supportive care and counseling. Which one do you think is actually the correct answer or the right answer to question number 18? So this all suggests pancytopenia, okay, due to what? Due to bone marrow failure, which is aplastic anemia. So you've ruling out the case here, which is aplastic anemia. Now the definitive diagnostic test to confirm this and rule out other causes like leukemia is what? A bone marrow biopsy. So referral for bone marrow biopsy is the correct answer under question number 19. On question number 18 rather. A 6-month-old infant with a family history of sickle cell disease is found to have sickle-shaped red blood cells on a blood smear. The most appropriate next step to management is what? Look at this 6-month-old infant. This is identical to a question that we did. Has a history of sickle cell disease and is found to have sickle-shaped red blood cells on blood smear. What's the most appropriate step in management? Okay, this is, of course, I said identical. We said that prescribe prophylactic penicillin, okay, to prevent those pneumococcal infections. Then 20. So the question here is, the answer is C. 20. A 45-year-old woman with a history of heavy menstrual bleeding presents with fatigue. This is also identical. But look at this. Look at this. Look at the answers that we have. Look at the answers that we have. We said actually hemolytic anemia. Read through the question myself. Laboratory tests reveal a low hemoglobin level and a high reticulocyte count. Yep. The bone marrow is overproducing these red cells. Increased RBC production. The bone marrow's response to the loss of the red blood cells or their destruction, pointing to hemolytic anemia. All right. 21. A 55-year-old man with a history of chronic kidney disease presents with fatigue. Okay, I think we even discussed this as well. We said erythropoietin therapy, the most appropriate management in this case. Look, it's very similar to that other question. We say erythropoietin therapy because look at this is anemia of chronic what? Disease. Chronic kidney disease. These are all close, easy ones. 22. A 30-year-old woman with a history of menstrual bleeding is found to have a low hemoglobin level, and the most appropriate initial management is what? we said oral iron supplementation. Okay, in as far as this is a repetition, but you need to recognize that we are just practicing here. We are practicing, so the earlier you answer the question, the better, because that actually helps. 23, a 4-year-old child with a known history of thalassemia presents with severe anemia, splenomegaly, and growth retardation. The most appropriate management is, of course, this one we didn't even stress, blood transfusion and chelation therapy. We also discussed this, so this is more like a repetition. Then a 25-year-old man with history of alcohol abuse presents with this one already we did. This is a repetition as well. Question number 24, we said referral for bone marrow biopsy, which is number 24. Then I think even 25, a 35-year-old man with history of ulcerative colitis presents with fatigue, dizziness, and pale skin. Yeah, we did discuss this, and we said what? We said that first of all, let's look at this. The most appropriate management. So in as far as they can be the same, we find out that, look at this, we have low hemoglobin, high reticulocyte count, of course, dizziness, fatigue, most appropriate management. Okay, I'm thinking corticosteroid therapy here. Why? Because we said ulcerative colitis, of course, is an autoimmune condition, and common cause of hemolytic anemia is autoimmune. Okay, autoimmune, and the first line treatment for autoimmune hemolytic anemia is actually corticosteroids. Yes. All right, I think I'm going with this because references says that corticosteroid therapy is the first line treatment for autoimmune hemolytic anemia. A 60-year-old man with a history of gastric bypass surgery reports increasing fatigue and shortness of breath. Laboratory tests reveal a low vitamin B12 level. Yeah, gastric bypass surgery. We said that for this patient, go with the intramuscular vitamin B12 injections. I'm not getting away with this one. A 25-year-old woman with history of, okay, this one I think 27. We said oral iron supplementation. I remember there's no difference. A 35-year-old woman with history of alcohol abuse. I think the questions are just repeating themselves, and I couldn't spot this because I was just, ensuring that I reached to 30 questions. They were not generated automatically, so I couldn't spot the difference. So question number 28, oral iron supplementation to muscular vitamin B12. So we are going with referral for bone marrow biopsy because this has to do with aplastic anemia. Question number 29, 6-month-old infant with a history of sickle cell is found to have sickle-separated blood cells and blood smear. Prophylactic penicillin. This has repeated almost 3 times. Okay. Then lastly question, corticosteroid therapy. Yeah. So with all these, I think we've repeated most of the things. I hope you've known how to answer the clinical scenario questions. You have a few of these clinical scenario questions, what they are all about, how to answer them, and also not only how to answer, but how do I approach a clinical scenario question. So with this, I would say thank you for listening and see you in the next lecture.